know, and then I will make a.
We're recording.
We are recording. Okay, we're going. Thank you, everybody, for jumping on here. I know that we'll have more people joining us as we go. My name is Farrah Culver. I am a doTERRA Blue Diamond Wellness Advocate from Alaska. I am just so excited to be hosting these lovely RNs this evening. And my biggest goal is that everybody joining this meeting, everybody watching the recording, will just have this huge boost of courage in your essential oil use. That the questions you've had around safety will be answered, that you'll get some new ideas for how to use them, and really, as we all move forward together using them more courageously, that we'll be able to take better care of our families and the people in our communities that need these the most. So I'd like to introduce our speakers. How this is going to work is this section is going to be about 35 minutes. Each of our guest RNs are going to speak for about 10 minutes. And then we're going to have about 10 to 15 minutes for questions and answers. I would love it if the questions were around things not already covered by what they say. Okay? If you missed something, I promise I'm sending the recording to everybody. So think of new questions so that we can cover just a broad range of everything. If you're looking for links or studies or maybe some deeper questions that we don't have time to answer, I will be taking a couple of those. We'll be looking through the questions that pop up in chat, and I'll attach a little bit of additional information in the email that goes out along with the recording. So don't worry, there will be a little bit more coming if we didn't add it here and if you feel like you didn't get it here. So our speakers are Holly Boyer. Holly is an RN from Alaska. She has just been instrumental in getting oils into the hospital that she works at there, specifically by sharing with anesthesiologists and surgeons that she works with. She'll tell you a little bit about using oils for people coming out of surgery for nausea. And she's going to speak to us a little bit about oils and safety for babies. I also have Ann Calhoun. Ann is an RN from Grand Rapids, Michigan. She has worked in NICU extensively, and she's going to tell you a little bit more about what she's done, where she's at with oils. Ann was part of a huge conference for nurses that took place this September. They were able to offer continuing education credits for nurses, and I just think it's fantastic what she's doing to move research about essential oils forward, especially in the professional realm of nurses and medicine. And then we have Kami. Kami, I don't even know if I'll say your last name properly. Kami also was a speaker at the nurses conference, so everybody here is getting a little bit of something very special from this big conference that happened. Kami spoke a ton on migraines, so I'm hoping that she'll share a little bit with us here about her protocols for that. I invited Kami, and Ann invited Kami, but I am excited to have her because Kami has a special needs child. She'll be able to chat a little bit about oils for special needs, but also she just finished up her coursework as a nurse aromatherapist. So I know there's been some conflicting information from aromatherapists, so I'm just excited to have her presenting this evening from that perspective as a nurse and an aromatherapist. So I'd love to start with Holly Boyer. If you want to pop up here, I'm going to go ahead and mute myself. Holly, take it away. The next 10 minutes is yours.
Okay. Hi, guys. I'm so glad that I got to be on and just share a little bit of my own experience, strength, and hope. I've been a nurse for 11 years, and I was introduced to doTERRA probably 8. I was really arrogant, honestly, and kind of a new grad, thought that I knew everything. And I loved lavender. I loved On Guard. And I was chronically sick. I'd been on antibiotics a lot my whole life for various things. And I worked at the Alaska Native Medical Center in Anchorage, and we had a lot of respiratory issues. I worked in kind of a step-down unit that had everything from end of life to post-surgery to, trach patients. And I would catch everything my first year. And so someone had introduced me to On Guard, and I was like, it's okay. And I got my tonsils out that year, and I thought I might lose my job because I was always calling out. And so I started just dabbling with the oils and kind of like, let's see if this works. Fast forward, I had a long fertility journey in that time period. I lost 4 babies, and I was working full time and just stressed out about trying to get pregnant. And it took 2 years to actually have my daughter doing fertility treatments. And so when I had her, I was on a lot of meds to keep her. And it was through that journey that I started to like dabble more with doTERRA and like actually look on PubMed. And I was reading things about oregano and this and that, because I didn't want to do anything to jeopardize that pregnancy. And what I found was mind-blowing. And I remember listening to Dr. Winterton talk. I don't even know if you can find this talk, but he was talking about how oils worked on the cell. And I remember being up at like 1 a.m. telling my husband, like, this is going to blow up. Every hospital will have this in the next 5 to 10 years, or you will be living under a rock. So after that, like, I just bought a huge kit. My daughter ended up getting RSV, and we were in and out of the hospital for 6 weeks. She would get steroid shots, nothing would work. And so a friend of a friend gave me the oils, or gave me a protocol, and I was religious about it. And I hadn't really understood that part, like less is more often. And so I was applying like every hour to 2 hours and diffusing and using different blends, and I'll share those with you. And within 3 days, like of really aggressively hitting the oils hard, and I was nursing her, she was fine, like 95% better. And I was like, are you kidding me? So that began my journey, really. I had no intention of doing this as a business. I just wanted to share, and I'm like very skeptical, and I like to cover things with humor. So I was just dishing oils out at the hospital I worked at to all the nurses, like, try this for this, try that for that. And it was mind-blowing what I was seeing happen. And just, I was laughed at a lot, but, we were in the PACU, and we had a horrible perianal abscess, GI bleeds. We were all carrying peppermint and wild orange, in our pockets. I was making everyone little 10 ml blends, putting it under our masks, and everyone was like, oh my gosh, it's diffusing the smell out. Or we would put peppermint on our hands or gauze and then like safety pin it on our, shirt. And that was like the only thing that was working. And so that just kind of a ripple effect. I ended up, we had a hospital that is very innovative. They're a magnet hospital. And I had a lot of patients that had C-sections, and the C-section patients would have all of the different antiemetics and still come out puking their guts out. And so, it was kind of covert. I hesitate saying this, but I remember being on night shift, and all I had was my peppermint, and I'd given them the second dose of, dexamethasone, Decadron, and Phenergan, and nothing would work. So I just put a drop of peppermint on a gauze and let them smell it. And the head of anesthesia at the time, his name was Hal Snyder, he's a doctor, he caught me doing it and was like, let me see that. And the patient woke up beautifully. And that kind of began this thing where he was writing orders for it before it was happening. And so they started a pilot study. And I ended up deciding at that point, I had all the nurses on board. Everyone had oils in their pockets for just little things. But I decided at that point that I wanted to work my business and like learn more about oils and be a mama than full-time try to get this, a study done in the hospital. So I kind of stepped away from that. They have been piloting different stuff. I don't know like if they've stuck with doTERRA because of the price point, but everyone's super open to it. So that's as far as I went with that. But I have a lot of nurses on my team and practitioners and some physicians that are loving doTERRA. One of the things with babies is that when Selah had RSV, I was just super hesitant. She was on Tylenol a couple times, and she would have a big reaction. She would flush, her heart rate would go up. She's got MTHFR gene. So I would use peppermint for fever, and I know there's a lot of mixed information about that. A couple of the studies that are out there, one of them in particular that talks about peppermint causing slowing breathing down. It was about a mom that actually took a 5 ml bottle of peppermint and dumped it on her chest. So you got to really pay attention to where your sources are and what's going on. So I always tell people that I use a tiny bit, like just a drop in a 10 ml, and I will do it the spine and the bottoms of the feet for my babies if they had a increased temperature. Obviously within reason, I'm not going to have a newborn with 104 and not take her in. But, obviously being safe you know, anything over 102, I'd be nervous, but I felt comfortable using the oils for that. And then Breathe is a great one. So I would just dilute appropriately. And I usually do, you know, a 2% dilution rate. So that was great for me as a tool, especially when she was sick. And then, I loved peppermint. But if you don't, like, if you're uncomfortable, you have to do your own research. For a respiratory blend that I loved on my kids was I would use Arbor Vitae, lemon, and frankincense. I do a drop each in a diffuser, or I would do it in a 10 ml roller and put like 1 to 2 drops each, and I would do that on her chest. Arbor Vitae is red cedar. It's actually sourced from Vancouver, and we have a lot of it in Southeast Alaska where I grew up. And the Alaska Natives would use that for respiratory healing. So I've already known a lot about it, but it's a powerhouse antiviral. However, it's very, very gentle. And so I love to pair that with lemon as your cleanser and frankincense, really helping with that healthy cell proliferation, also boosting the, you know, the immune system and helping with your respiratory system. So that's one blend that I always tell mamas with little ones under 1 to diffuse, to use on their chest or on the back of their lungs, and then put their jammies on, or, you know, I love peppermint to cool, but just very, very diluted. And then a blend that I also, you know, love that everybody probably knows about is the flu balm, but I think it's a powerhouse. If you have a sick kid, I use this on Selah when she had RSV. I would do a 10 ml roller with like 1 to 2 drops of obviously the Frank On Guard lemon, melaleuca, and oregano, and then I use Melissa. And Melissa is your powerhouse, the big guns. And that is really what kicked it for us those 3 days, and was a game changer. And I remember going back into the pediatrician, and he was shocked because I was right at that cusp where she could get admitted or could not get admitted to the NICU. And I was super comfortable managing her airway and just paying attention to the signs. But I'm a nurse trained in airway, so I was blessed that way. However, using your oils are a powerful tool that you can coincide with, you know, your providers or whoever you're seeing for medical attention. Am I on time, Farrah? Have I spoken for 10 minutes? No? I'm good? Okay. Yeah, so that is a little bit about me. And then now I think I'm just super passionate about oils and healthcare. I think it's a beautiful marriage. I think that sometimes we get polarized on things and we get black and white about this or that. And we live in the best country for acute care. If you get in like a car accident or you need a kidney transplant, we can rock that. But preventative care, I would just love to see people take ownership of their own health and wellness and be advocates for themselves and not hand their power over to physicians, but actually collaborate with them. Because one doc or nurse practitioner in 15 minutes can't like treat a lifestyle. And so oils for reducing your toxins in your home, cleansing your cells gently. I tell everybody, you know, be taking grapefruit, frankincense, and copaiba and turmeric in a veggie cap every day for healthy cell turnover, reducing toxins. I just think it's like they're a game changer and they can really transform your health, but I feel that everyone can be empowered to do that for themselves. Like if I had one mission statement, it was that I would love to empower everyone to be their own advocate. I think as a nurse at the bedside, we often see patients faced with these harsh realities or these really crippling diagnoses, and they feel like they're beholden to whatever anyone tells them to do rather than them having the tools to navigate, figure out what works for them, and start making some huge lifestyle changes. And oils are just one piece of the pie, but they're a powerful piece that can open up the keys to so many other avenues that we can address. So that's kind of my heart and passion. I love oils. I think I did nursing for 11 years. I'm still going to be in it, but I'm burnt out, and I think oils are just so happy and uplifting for me. So that's a little bit about me, and I'm grateful to be on the call and just share a little bit about that. Last thing I'll tell you, my favorite blend though right now for all you mamas is take a 10 ml roller and put 15 drops of Balance Wild Orange, Siberian Fir, and what was the fourth one? I just gave this out to my whole team. Balance, Siberian Fir, Wild Orange. It's sandalwood, and then fill the rest with coconut oil, and it's amazing. So yeah.
Awesome. Holly, can you type that in the chat?
Yeah.
Blend. And then you also gave something that you take in a capsule. Copaiba, turmeric. What else was in that capsule, and how many drops do you put in there?
I do a lot more, but for everyone for healthy cell turnover, frankincense, copaiba, turmeric, and grapefruit. And if you want to get, like, you need metabolism support, I add in yarrow palm, I add in pink pepper. And And the only reason I tell you all that is my family has been ridden by cancer. I've had my dad's, all his siblings and parents have died, like not all, 4 of them, and then his parents. So I'm super big on detoxing your cells and taking a preventative approach. So that's just what we do daily.
Perfect. And when you say healthy cell turnover, that's part of that healthy cells. For those of on here us that are not nurses, we want our cells to replicate healthy new cells, not sick mutating ones. Is that a good way to explain healthy cell turnover?
Yeah, your cells, if they're absorbing oxygen appropriately, then they can do what they're meant to do. And frankincense can tell if a cell has apoptosis, so if it's a bad cell and it's past the point of repair, or if it can heal itself. And so it's really miraculous, you guys. So frank is a huge one, and then turmeric is amazing for the liver, and it's neuroprotective. And then I also, because your liver is your filtering organ, that's like your what part of the truck, it filters all the garbage out. So you got to really pay attention to that. And then I love just lemon or grapefruit as a cleanser, great for metabolism, great for blood sugar. And these little things can like just transform your health over time if you're diligent with the little things.
Awesome. Thank you so much, Holly. I love your perspective. We might have some questions come up around using oils on babies and children toward the end, or if you see them in the chat, would you be willing to chat about that while Anne talks?
Yeah, for sure.
Awesome. All right, Anne, I'm excited to hear from you what you've done in the hospital. Maybe if you just put a little plug in for the nurses conference. I love that happened. I think it's fantastic, and just what you're doing. So yeah, I'm excited.
Yeah, well, okay, so I'll start with that. If you're a nurse, you have to be a nurse, but if you're a nurse, can you guys hear me? Give me yeah, okay. So if you're a nurse, there is a nurses conference, September 8 and 9. Is this right? Sunday and Monday. And it's a day and a half. Last year we did a day, and it was the first one ever. And it was kind of like this big risk of like, we hope somebody shows up. And it ended up being like, oh, they're beating down the doors. What to do about this? And so we have a bigger room, and last year it was not only live streamed, but you could purchase the recording, and it was just fantastic information. So my name is Ann Calhoun. I live in Michigan, and my oil journey started about 6 years ago when a friend of mine who's not a nurse brought them to me and had me smell them. And I thought they were, I was happy for her, okay, is how that went. But I'll tell you guys that it's really not until somebody is desperate and has run out of options or has some extenuating motivator that, especially I think nurses, they're willing to do the weird thing and do this. And so anyway, at the time I had a 2-year-old, and he was on a cycle of antibiotics and steroids for a skin condition. And as a mom, I wanted to solve the problem. I wanted to figure out exactly what was causing it, and I wanted to solve the problem. And so we ended up going to some specialists who said, I'm really sorry. There used to be a drug company that made a serum to sensitize your kid to mosquitoes, which was the issue, except the drug company wasn't making enough money, and so they quit making it. And so I was furious that my son's health and treatment came down to money. So very sarcastically, I said to this specialist, well, what do you want me to do? Put lavender oil on it or something? And she said, well, yeah, you might actually want to try that. And I was disgusted with her. And so I did. I came home and I tried it, and it worked. And I was absolutely blown away. So for less than a nickel, right, my kid was off of his meds, and I was didn't have to leave the house anymore when this situation popped up for us, which was all summer long. So that then got me really looking into why was this working, and why wasn't anybody talking about this? Why was this an amazing solution that no one was talking about? So ever since then, we have been using nothing but oils for healthcare in our home. And not only as healthcare, but we really are so much better in my house about finding root causes and seeing the body as a whole and not just shotgun approaching symptoms. And so that's been really helpful as well. So it was interesting to me to be able to go to work and talk to other nurses who are moms and who are women and men, right? And just want to be healthier. They want to sleep better, right? Because if you know hospital life, it's all across the board, 12-hour shifts, days, nights, all of that kind of stuff. But what actually happened in my hospital, I'm going to tell you guys, is they started making policies against essential oils. And you'll find that healthcare systems are open and some healthcare systems are not. But it's absolutely true that really the way to talk to nurses is, in my opinion, not necessarily let's use them for your patients right off the bat, but let's use them for your kids. Let's use them for you. Let's use them for your husband. Let's use them for your pets, right? Those sorts of things. Like having a personal experience is what's really going to help turn the tide. So on the flip side of that, the interesting thing is that the hospital that I worked at, which I no longer work at, I worked in the neonatal ICU for 15 years, both as a bedside nurse and as a staff educator. Although they're writing policies against it, another local hospital has diffusers in labor and delivery rooms, and another local psych hospital has got a $25,000 grant for oils for their units and their patients. So good things are happening. So a few things that I love that I would love to share with you guys. I think most nurses and I think most people start oils for very physical issues, right? They want to replace a medication, or they want to deal with something that's really bothersome. That I think can be seen very physically. And so for us, it was that cycle of antibiotics and steroids that I really wanted to solve. And I still have people come to me on a fairly regular basis, seasonally, most often, and say, hey, I got bit by this bug, I got bit by this spider, I got bit by this bee, whatever the situation is. But by the time they tell me about it, it's now this big and it's red and it's swollen and it's shiny. And so here's what I recommend when that situation happens. When you have a localized area that is warm and red and swollen and maybe even shiny, is in the back of your Essential Life book, you can find the oil properties chart. And for nurses, like, this is our language, right? And so if you look and find the antibacterial list, which is most oils, quite honestly, and find any four that you have, and put 10 drops each in a roller ball for a dilution of 40 drops total in a 10 ml roller ball. And depending on how bad it is, you might have to apply it every 20 minutes or every 30 minutes, right? If it's not too bad, you can go every hour. But I always say, do something with oils really, really aggressively for a certain period of time. Because I think people who are new to oils, they think, well, so I'm totally switching and I'm leaving this option out completely, and now I'm just supposed to hope that this works. You know what you can do, whether it's, a situation with your ear or sinuses or a situation like I suggested, or the flu coming on, right? Just say, okay, I'm going to do this really, really well for 12 hours or 24 hours, or maybe even 48 hours. Right. And so I have a bunch of nurses on my team, and of course they're skeptical. Right. And so they get a strep throat outbreak with their kids, and they go, all right, I doubt this stuff is going to work, but I'll give it 24 hours. Right. And if it's not better in 24 hours, then I'm going to go to the doctor. Awesome plan. Awesome plan. Give yourself a time frame and give it 100% in that time, knowing that you always have this plan B of doing what you've always done if you're not happy with the results within that time frame. Okay, so my other favorite one is one of the themes that I've been seeing over the past probably year in my conversations and in my classes is anxiety, and people just really feeling overwhelmed with life on a regular basis. And so I thought, I had heard great things about the oil Melissa. Will you just raise your hand if you own Melissa, if you use it, if you love it? Okay. A good amount of you. Okay, good. Well, I was one that like I had it because quite honestly, I love the antiviral properties of it, but I've never used it for anything more than, again, the virus portion of it. So I've heard of people using Melissa on a daily basis and seeing really, really great results in their mental health. Well, there's no better time to try something than over the holidays when everyone's overwhelmed, everyone's losing their mind. Everyone is like, we have to be done with this, right? Christmas is not even a joyful time anymore because of all that goes into just making it happen. Because of course now it starts after Halloween. And so it's so long. So what we did on my team is we said, okay, from Thanksgiving to Christmas, we are going to do less than a drop of Melissa on the roof of our mouths every single day. And I don't care when you do it, morning or night, but just, so here, what you do, it's less than a drop because Melissa's expensive, right? And you don't want to use more than you have to. So just put your thumb on the top of the bottle, invert it. So you just like get a little on the top of your thumb and then hold it to the, what we call the soft palate. So right in front where your teeth are is the hard palate. And then back behind there is the soft palate. So just hold it up there. 30 seconds is good. If you're kind of a gagger like I am, I actually like to put a little bit on the tip of my tongue and then like hold my tongue up there. So like, it's just easier for me. But the response was amazing. The response was like, I'm actually having a happy holiday. Like I have this huge to-do list and it's like, it'll get done. And people were saying like, I'm getting stuff done on my to-do list that's been on my list for years. And so, if you're looking for something to use on a daily basis for amazing mental health, I highly recommend Melissa. And here's the cool thing is that if you're using it over the winter, it's also going to help keep you healthy. So with that, Kami, it is your turn.
So I just wanted to say like, yes and amen to everything that they said. I wish I was taking notes, but I'd be totally distracted by just responding. So yes, I am. So I actually, my background is trauma critical care. So I still work at a very, very busy university hospital in Philadelphia. I call them the Knife and Gun Club. Those were my people. So lots of gunshot wounds, lots of adrenaline, lots of car accidents, really tragic things happening to people. And then about 60 years ago, I suffered a back injury, not at work. I mean, I don't think nursing really helped, but I had to completely shift gears. And I went, shockingly, I went into home care, but hospice. So I went from like saving people's lives to helping people transition with grace and with peace on to the next life. So it was really powerful for me. I've actually gone back now and gotten my wound ostomy and continence certification. So I'm a wound care specialist still in home care. And like Farrah said, I am one final away from my nurse aromatherapist certification because I love certifications. So I'm super excited. I'm very passionate about oils. So funny. Like my story with oils was my daughter has horrible seasonal threats. She reacts to everything, indoor and outdoor. Even though I breastfed and made my own baby food, it really, really gets on my last nerve that she's allergic to everything. And nothing we were doing was working. She was on 4 prescription medications at 12 years old. And I will never forget, it was February, freezing cold. I live in the Northeast. And my daughter walked down the stairs and she had a tissue stuffed up in each nostril. No lie, this is February, right? So tissue in each nostril. And this had kind of been her look for like 6 months. And I looked at her and I was like, oh, it was like all of a sudden I realized what was happening as I'm like doling out her medications for the day. And I was like, something is not working. Like, what am I doing? Hard stop. Like, let me figure out something. And that was back before compliance. So on Facebook, there was a post about essential oils and allergies. And I was like, by a friend. And I was like, I don't care. I tell people because I was super skeptical like Anne, and like Anne said, you don't really look into something until you're like desperate. So at that point, honestly, if I had gone to my friend's house and she had taken me to like the voodoo man in the back of the room with like the cauldron and the eye of Newt, I legit would have bought it. That's where I was in my life. Like I just needed my daughter fixed, right? So I would have mortgaged my house and been like, you're going to fix her. So anyway, get my little kit, and it comes to the house, and I'm over at the sink, and my husband comes home and he's like, what is this? He thinks I've completely lost my mind. And I was like, you don't get a say in healthcare. I'm the nurse. He's a teacher. So like, stay in your lane. This is my lane. This is what we're doing. My poor husband. So anyway, so then my daughter, I'm like, take this. Now, funny story, we all get all bent out of shape about internal use, right? I made my daughter drink it. I didn't know any different. 2 drops each, lemon, lavender, peppermint in this water, not even in a veggie cap. Man, just take that like a shot. So I didn't know, but I was desperate. So it's just so funny when people get their panties in a bunch about internal use. I'm like, that's how I started. And she took it, and it was the first time in 6 months that my daughter could breathe out of both nostrils. 10 seconds later. And she looked at me and was like, oh, Mom, I can breathe. And my husband, who thought I was insane, was on the other side going, oh, she can breathe. So I was like, oh, all right. So what else can oils do? So we got on the allergy train. I have a special needs son. My middle son is autistic, ADHD. He's got an intellectual disability. He also was the kid that was sick with everything. My child was in the pediatric intensive care unit in respiratory distress because of the common cold. That's my kid. That's just him. He got sick all the time. If my other kids got the cold, they were fine. They would get over it, and he would be hospitalized. It was horrible. The first 9 years of his life were spent a lot of the time in the hospital in very dramatic situations. And I was actually more nervous to use oils with him because I call him like my most vulnerable child, because he tends to react to things a little bit differently than my other children do. But as I started feeling more confident using them with my daughter and myself, I felt like, okay, all right, so let's see how this can help Jeffrey. And I really focused on his immune system at first, because we were to the point where his doctors were sending us to an immunologist because we didn't know why he was getting sick all the time. So we did all the metabolic testing, all the immunology testing, which is all scary stuff, because when that stuff comes back positive, like it means bad news for you long term, like developmentally and lifespan, really. And so all of the testing came back negative, and the docs, and I go to Children's Hospital Philadelphia. It is a premier children's hospital. They're phenomenal. So specialists, the best docs you can find. And a lot of them kind of did this with Jeffrey, like, I don't really know. And I was like, oh, you don't really know? If you don't really know, what am I supposed to do? So I was really focused on his immune system. So On Guard was big, diffusing. I learned very early on that getting a consistent regimen is incredibly important. So we are used to, in healthcare, we're used to treating symptoms, right? It's very reactive. And what I have learned is that proactive is so much better. It gives your body a leg up. Right? We want to do a favor to our body. We want to help it have a natural, healthy immune response versus like, oh, now you've been hit with all these germs. I guess now we'll help you. Like, let's help it from the beginning. And so I got very serious about supporting his immune system. And my husband and I laugh because over the 6 years that we've been using oils, he went from missing 35 to 50 days of school in a school year, because now it's all on the computer, to missing like 2. And this is like doctor's appointments, basically, is when he has to miss school, right? When he goes to the doctor. It's incredible. It has legitimately changed everything. And when what Holly was talking about as far as empowerment and being proactive, like that is so important. It empowered me as a mom that I didn't feel like, oh no, what's going to happen? Like, what other shoe is going to drop today? Like, are we going to go to the hospital? Am I going to have to be away from my other children? I mean, I'd be pumping in emergency rooms because I would have a baby at home and a child in respiratory distress. Like, how do you even choose between the two? But I had to. I just had to do what I had to do. I'd have to send my other kids off to grandmom and like go take care of my son. So, and then I was taking care of patients in the hospital. So I was exhausted. Like caregiver fatigue was real. It was hard. So dealt with his immune system first and got really good control of that. And then what was interesting is his health started to change for the better. But unfortunately, he has a migraine disorder. And so his migraine disorder have you guys ever heard of cyclic vomiting syndrome? It is a horrible, horrible thing. So he was diagnosed at age 3 with cyclic vomiting syndrome, and it's an abdominal migraine disorder. So you don't get a headache, you get unrelenting nausea and vomiting. My child would puke every 30 minutes for 12 hours. He would become dehydrated. We would have to go to the hospital and get IV hydration. He would need antiemetics, so anti-nausea medicine, but like nothing was working. We dealt with this from about age 3 to 9. He was on some prophylactic medication for that. There's really not a treatment for it. So we were just managing. And then we had a nice little hiatus between like age 9 and age 13 where things were great. I actually thought he was growing out of cyclic vomiting syndrome. But, you know, there's this low percentage of children with juvenile cyclic vomiting patients that, guess what, around the age where they get hormones, which are fun in their own right, they decide that cyclic vomiting sometimes will convert to a typical migraine disorder. And so Jeffrey had his first actual headache. And he had one, it was kind of vague. I wasn't really sure that that's what was happening. And it sort of went away on its own. And I was like, okay, that was a little different. Things are changing. I was talking to his neurologist, and exactly a month later, he had another one. Well, this one was so severe. We were home for 4 days trying to do all the things. I mean, listen, full disclosure, his neurologist knows I put IVs in him at home. I hydrated him at home. Like there's stuff I just don't go to the emergency room for anymore. Like they know, they're all like, yes, we know what you did. I'm like, okay. So they just know who I am. Everybody's very comfortable with that. Been doing this a long time. I know, and like I'm crazy, but it is what it is. And so I was doing all the things, but he wasn't getting better. And it was very clear that the head pain was horrendous, and he was vomiting, and it was just bad. We were just not going in the right direction. And we'd actually tried a migraine abortive medication. It's one of the triptans, and it didn't work. And so finally on day 5, I took him into the emergency room. So we went in, and there's a migraine protocol. When you go in, if you've ever needed like infusion therapy for migraines in a hospital setting, there's a protocol that they use. There's like a tier of medications. They gave him the first medication. It didn't work. They went to give him the second medication. And unfortunately, he was in a horrible heart rhythm. It started a whole nother cascade of events, but we had to deal with that. And over the course of 8 days, they tried every single medication, including one that I had to like hijack from a friend who has a husband with a migraine disorder. Like she literally brought it into the hospital because we could not find it. There's just not enough of it. And she had some in their fridge. She brought it to the hospital. Pharmacist looked at it and they allowed Jeffrey to have it. It was crazy. So we tried everything. And his neurologist, whom I respect, literally came in the room day 6 or 7, I guess. And she said, we're running out of options. Like, I'm not sure that we're going to be able to break his migraine. Okay, my kid's 13, guys. Like, he's going to be in pain for the rest of his life daily. Like, are you, like, I was delirious. He'd been sick for like 10 days. I had been doing this. It was horrible. And I was really upset. And then I was really mad. You know, I was really sad. And then I was really mad. And their option at that point was, we're going to do a nerve block. So a nerve block is lidocaine. They did 13 injections into his skull. So you've already got head tension, you've already got head pain, you're already unhappy. He's autistic. He's on so many medications, I can't even tell you. He was like out of his mind. And now we're going to inject him 13 times in his skull. So they did that to numb him. He went from like a 8 out of 10 pain, couldn't even open his eyes, to maybe like a 6, but enough that I could take him home. Now, the whole time he was in the hospital, I was doing research like a mad woman because I couldn't do anything else. So researching migraines, like vitamins, supplements, essential oils, like what alternative therapies are there? Like what can I do for my kid? And so by the time I left the hospital, I had an idea. He needed this much thiamine. He needed this much riboflavin. I could use these essential oils, blah, blah, blah. Came home, I kind of had a plan. I was like, all I need, honestly, in my mind, I was like, I just need to get my kid home because I will fix him. That's honestly, that's the way I felt. You can't fix him, I will. Just watch me. That's my personality. So I brought him home. First thing I did is lifelong vitality. I am telling you, if you have a body, you need lifelong vitality. Let's just start there. But if you have a migraine disorder, autoimmune disorder, high blood pressure, high cholesterol, feel funky in the morning, fall asleep at 3 o'clock, get yourself on lifelong vitality. It will change your life. It changed my son's life. So got him on lifelong vitality because that's the foundation of all the things, right? Foundational nutrition, super important. Our American diets do a sucky job. I was about to say a bad word, a sucky job at that. So listen, I'm a trauma nurse. I have a little bit of a truck driver mouth. So lifelong vitality, number one. And then the oils that I found that I decided to put together in a blend, and this is what I presented at the nurses conference. So frankincense, just like Holly talked about, so super important. It has a lot of neurological benefits, helps the cells oxygenate. Your brain needs a lot of oxygenation. It's also a potent anti-inflammatory and analgesic. Analgesic means pain, okay? The next one was copaiba. Do we not love copaiba, right? Anything pain related, anything neurological, it's neuroprotective, which is so important, especially for my son's autism, right? So I felt like it was a dual purpose. The next one was helichrysum. Helichrysum, all the expensive ones. Helichrysum has very potent anti-inflammatory properties. There is a reason why helichrysum is it's also called everlasting. The flower, it just lasts forever. Like the properties in it are so powerful. For that flower, it's yellow. For that flower to hold its yellow color for such a long amount of time, can you imagine how many antioxidants and anti-inflammatories are in that flower, right, to protect it? Like, just think about that, right? There's a reason why it's as powerful and as expensive as it is, okay? So helichrysum. And then the fourth one, this might be shocking, is black pepper. So black pepper is really, really powerful for the brain, and it is a potent analgesic, and it has anti-nociceptive properties. That is pain as well, all right? So it helps those receptors, those pain receptors, to not really feel the pain. So I put those 4 oils together in a roller bottle. I'm a little heavy-handed, even though I'm an aromatherapist. I'm a little heavy-handed with solutions. So he's a big kid. He's bigger than me. So it was 20 drops of each, frankincense, copaiba, helichrysum, and then I did 10 of black pepper. You can absolutely dilute it more if for littler people, or if you just want to start slower. But I'm a little aggressive. So same thing, kind of Anne, like I was like, I'm just going to hit this hard. I mean, he just had a nerve block. Like, I just need to fix this situation. So we did that. And here's the cool thing about it. That was August of 2016. I'm losing my years. 2016. He had 1 breakthrough migraine 2 weeks later. We took him back in for another nerve block just to be sure. He has not had a migraine since. Not one, guys, not one. The other thing that we noticed, so he's autistic, and he has some behaviors. He gets super frustrated. What we started noticing is that we would use the oil blend when he was starting to escalate with his behaviors, and he would immediately calm. My husband and I, our business is The Essential Couple. If you follow us on Facebook, there's not a plug for you guys to all like become my followers, but I have a video there of me actually applying. So Jeffrey's upset at the dinner table. I walk over, apply the essential oil. I do it topically down the back of his neck. I call it a sneaky swipe. If you've got a kid with special needs who may, sometimes he like moves fast or like pushes me away and he's much bigger than me, I don't want to get hurt. So I'll do a sneaky swipe. My husband will kind of distract him and I'll just walk behind and like, whoo, swipe it down his neck, and I'm gone before he even knows I've touched him. And you will see it's like 3.5 seconds and my kid starts to smile and laugh. It's incredible for de-escalating behaviors. And so we've actually replicated that with multiple people on my team who also have special needs kids, ADHD, oppositional defiant disorder, whatever, escalating behaviors. It's been really, really powerful. And that was just a happy side effect that we found. So I call that Jeffrey's blend. I'm more than willing to share. I have a graphic of it. I can give it to you, Farrah, and you can disperse it, but called Jeffrey's blend lovingly. And let me just talk about internal use. I know I promised I would talk about that a little bit. So back to empowerment and self-advocacy, okay? That is exactly where I stand. Listen, physicians and Western medicine, we're really good at acute care, really good. We really suck at chronic care. And so it is your job to take care of yourself proactively. And if you've got some chronic situations going on, you need to take control of that and do your own research, because in order for you to feel confident, you can listen to me all day long. In order for you to feel confident when you're sitting in your doctor's office and saying, well, I'm choosing to use X instead of what you're telling me to use, right? Or I'm going to stand on this truth that I know, you need to do your own research. And sometimes we all love doTERRA, but there's certain physicians and people that I interact with that they want a different source. So this is my favorite book of all time. It's called The Healing Intelligence of Essential Oils. It's by Kurt Schnaubelt. Do you see him? I'll put it in the chat too. But this is absolutely fabulous. And it has information on internal use. He's an actual aromatherapist in California. And he talks about how, you know, he kind of he deciphers through the like hysteria, like don't use anything internal, to like, let's use common sense. Guys, a 15 milliliter bottle of lemon, I believe it takes 45 lemons to make that bottle, okay? If you walked into a store and there was lemons sitting in the produce aisle that said, do not eat the rind, would you buy the freaking lemon? No, you should be able to zest that and put it in a recipe. Nobody's telling you to take that 15 milliliter bottle of lemon and down it. We're talking 1 drop, 2 drops in a 24-ounce bottle of water. Like, that's all you need. It's like zesting the lemon. We eat essential oils all day long in our processed food. They're in fruits, they're in vegetables. If you do it safely and with safe amounts, 1 drop, 2 drops, right? You're going to be fine. I have overdone internal use. Funny story. Last year at leadership, I chose to take 8 drops of DDR Prime at once in a veggie cap. Not recommended. I detoxed a lot all night. Felt great the next morning. Felt great. I was like totally cleared out. Like it was like somebody took a scrub brush, my colon, right? But like the new oiler, don't do that. Like start with 1, right? Right? So use common sense. Think about it. Is peppermint something that I would like pick and put in my mouth? Yes. Okay. It's probably safe. It's just, this is a highly concentrated form. Like, let's just be careful. And what's nice too, if you actually look into the research, and some of the book gets into that, it talks about how essential oils are actually protective of mucous membranes, because you will hear, if you drink lemon, it's going to burn a hole in your esophagus. Not if you look at the research. Or if you take, it's going to put too much pressure on your liver, right? Like you'll hear that. Essential oils actually encourage the enzymes, the liver enzymes, to detox the liver. So they actually help alleviate the load of the liver, and they'll just pull out more, which is awesome. Clearly, if you have a liver issue, you might want to use less, okay? And internal use, it actually goes straight to the liver. So you might want to think about that, like topical versus aromatic versus internal. So just use common sense and really get this book. Like if you want to feel confident, get this book and read it and commit it to memory, and it's going to help to be able to guide others in that direction. And I could probably talk for hours. So I will stop now. I probably went over.
No, you're great. I could have listened to that, for another hour. It's just fabulous information. And all 3 of you have given us blends, protocols. I mean, I feel like I have someone in my life I'm going to go home and take care of with this migraine protocol right now. I'm starting her on the LLV. I hadn't yet, but it's time, and I'm going to make up.
Oh my gosh, it's time. I had people walking up to me in line at leadership from the nursing conference and other like teams that I've shared it with that have had, here's the book, that have had success. One woman told me that she went to see her neurologist, and he was like, what are you doing? And she was like, I started this protocol. He took her off all of her meds.
That's awesome.
And listen, so migraine meds, like lots of side effects. So my son actually has to have a heart surgery because of one of the migraine meds that they gave him 2 years ago. Yeah. So they're real. I mean, they're helpful for people, but there's some pretty serious things that go along with it. So yes, LLV and Jeffrey's blend. And let me know how it works.
Perfect. All right. So if anybody has a question that you would like to type into the chat, please do that. If you would like to be unmuted, I think there's a little like raise your hand thing. We can unmute you and get your question. If you love this and have somebody that you would like to hear directly from a nurse, I think we're going to do this again. This is just, I learned so much. So Kami, or, Holly or Ann, if you have seen a protocol, do any of you have a protocol for the cyclic vomiting disorder? Or Kami, would you use the same one that you used for migraines on your son?
So, I did try for years to come up with a protocol for cyclic vomiting. Honestly, that was the one thing I didn't really have great success with. And what I should have done back then that I didn't do is start him on Lifelong Vitality. I was kind of new and skeptical and kind of was just doing the oils, but I do think Lifelong Vitality would be really helpful. I think that Jeffrey's blend would definitely be helpful. I would add some GI, like some anti-nausea oils, like either peppermint or ginger or cardamom's really gentle, depending on the age of the child. I like that. I'll alternate the cardamom. I'll take that. I will take the peppermint out and I will put in some cardamom if it's a younger child, just because it's more gentle, or even digestin. You'd probably have to play with it a little bit. Cyclic vomiting is hard, really, really hard.
Okay. All right. It looks like that is the questions that we have so far. I got one more. With kids, do you recommend we use roller balls? What are the best ways to support kids with essential oils? Roller balls, rubbing it on, like what's your best suggestion just for starting out supporting kids? And Holly, you talked about kids a little bit, so will you take that one?
Yeah, there's two ways. I mean, you can make your own blends, but I really have been loving, because my kids are 3 and 5, so they're still little. doTERRA made an incredible line for kids. Like, I don't even need to recreate. So my kids have little colds yesterday and today, and this is the protocol I did. I had Stronger along their spines and feet probably every hour to 2 hours with the Rescuer blend. And then we did detox baths, which I'm huge on, when I use a cup of raw Epsom salts and baking soda. And then my little guy's 3 and a half, and he's kind of a tank. So I let him play for 30 minutes and just absorb those Epsom salts. And I put a little bath oil. I put 3 drops of marjoram, frankincense, and lavender in the bath. And then I oil him up when he gets out of the bath. I give my kids oils internally. I just do like barely a drop of lemon or wild orange in their hydro flask, and with icy water. And then I just use those blends a lot. But I mean, if you have different strategic things, like I will do the flu bomb and add Melissa. And for my kids, I'll do like 5 drops each in a 10 ml roller. I'll do the oregano, Melaleuca, Frank, On Guard, Melissa. If we're really hitting something hard. For growing pains, I love to, use the Rescuer blend, or I'll do Aroma Touch. I'll add a little marjoram and frankincense to that as well, with some cypress. For my little girl has had 2 she's broken her tibia twice. And that actually, I will tell you a really quick, really cool story. She was 2 and a half, and she likes to jump, and she was in tumbling. And so she jumped off of like a 5-foot dresser twice and shattered it. And she was casted from her hip down, and we were told she'd be casted for like 15 weeks-ish, and I had a baby and this little 2-year-old. So I took a bottle of helichrysum, and I did frankincense, helichrysum, and marjoram, and I put like 15 drops each in a 10 ml, because I was like, we're going to address this. And I'd heard Kristen or Kyle Kirschbaum talk about this. A few people had. So I just applied that in a 10 ml roller on her toes and on her upper hip, not even where the issue was, like probably every 3 to 4 hours. And we went in at the 7-week mark, and the surgeon was shocked at the bone regrowth, and he took the cast off. So that is a powerhouse for bone regeneration, bone regrowth, and just inflammation and all of that. I mean, it hurt. It was no joke, but she is done amazing, and that happened 3 years ago, and she's great, and she's in gymnastics. So I mean, I use a lot what I use for adults. I just dilute it down, so that's important. But I utilize the kids line now all the time, and my kids have oils on their dresser, and so they choose every night what they want in the diffuser. Like last night she put on Brave and Stronger, and then she wanted me to massage her back with a little bit of Balance and Wild Orange. So they intuitively know, and they are always using oils. So yeah.
Awesome. Thank you. Holly, will you type that into the chat, that blend that you did? And then
Yeah.
Kami, so I'm asking you the question, but Anne or Holly, if you have ideas on how to do this. So the question came up, how would you get LLV into a 6-year-old? I'm going to answer it first because I started my 7-year-old on LLV. I believe in those supplements so much. They are, the dosage on the bottle is for a 150-pound person. So I was completely comfortable knocking that dosage down, opening the capsules, putting them in a smoothie for my skinny little 7-year-old when she started. We do have some children's supplements, but since we're speaking specifically about something as severe as a migraine, Kami, would you recommend LLV for a little one and dosing it down?
Absolutely. Yeah. And that's what I was going to say. I mean, just, you know, if they're quarter size of an adult, give them a quarter dose, and you can open, you know, the capsules if they can't swallow. That's a nice thing. You can open them. I mean, you will have to, they won't be able to take the fish oil, so you can always get the IQ Mega. That's totally fine, liquid. It just depends, but if they're able to take pills, absolutely. Quarter dose, half dose, just depending on weight.
Awesome, thank you. All right, we are out of time. Anne, will you wrap us up? If there was one thing that you would put on a billboard to tell 1 million people, as a nurse, as somebody that believes in essential oils, what would you want the message to be?
I'd want my message to be that plants were the original medicine, and that we live in an amazing age, that we have access to the healing properties of plants from around the world in our homes, and we should use them.
Awesome. Thank you so much, ladies. I appreciate this. Everybody that's on here, this recording will go out in an email, and this was fantastic. Thank you. Have a good night, everyone.